Good morning, folks. I am going to ask us to come to order here here on site at MCH and Mumsy, and issue a very heartfelt good morning and welcome to everyone who's joining us today for our town hall. I'm Bruce Squires. I'm president at McMaster Children's Hospital and VP of Women's and Children's Health here at HHS. And as I said, it's my pleasure to welcome all of you on behalf of the HHS and the local MCH leadership team as we host here today our Hamilton Health Sciences Town Hall. We've got for those of you online, we've got a great group in attendance here on the fourth floor at MCH Mumsy, and for those of you here in the room, we have a great group attending from across our HHS sites. I do want to start, as always, by acknowledging that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of the land. In particular, in the area that we now know as Hamilton, we recognize that we're situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and the Mississaugas. We also recognize that we are on lands protected by treaties, namely the Two-Row Wampum and Dish with One Spoon Wampum, that signify the important stewardship of the land, as well as respect and responsibility towards one another. Now, I do want to highlight that you're seeing one of our signs of welcome that are situated at HHS sites across the organization. And this particular sign of welcome is Turtle and Seven Generations. It was created by Tracy Anthony, and Turtle and Seven Generations includes the image of a turtle. The feather on its back has 7 segments, and those 7 segments reflect the 7 generations principle, that the decisions we make today should result in a sustainable world 7 generations into the future. It's one of the reasons why I really love this particular sign of welcome. The 4 legs represent the 4 directions, such as those found in the medicine wheel. Now, I think it's also, of course, an important and valuable time to mention that September 30th is again Orange Shirt Day and the National Day for Truth and Reconciliation. At HHS, we are committed to addressing anti-Indigenous racism within healthcare, and this commitment is reflected in the ongoing work to develop an Indigenous health plan. We're grateful to all of you that have already engaged to provide your valuable feedback on our approach to Indigenous health and truth and reconciliation. I'd like to encourage everyone to wear an orange shirt on September 28th, 29th, and 30th in solidarity with Indigenous peoples. And there are now Every Child Matters flags at our main sites, including here at MCH, as permanent symbols of remembrance of the devastating history of residential schools in Canada and HHS's commitment to reconciliation with Indigenous peoples. Let me encourage and invite, again, all of you to learn more and build your own awareness. We have wonderful resources available on the HHS site that are accessible to each of us. Now, to today's agenda. We're really proud to welcome and to feature an update from our President and CEO, Tracy McArthur, as well as a site update and some, I think, really interesting spotlights that you're going to hear about from our leaders. We're going to do a Q&A session right after Tracy's remarks. So that's your opportunity to ask questions of our top leader. And I know there's some great questions in the audience. Then we're going to hear from our presenters, and then we'll open it up for Q&As again. And so you can hear from your colleagues about the wonderful things that they have underway. And again, we focused in particular on those things being done at McMaster Children's Hospital and Ron Joyce Children's Health Center and at the McMaster University Medical Center. Then we're going to end with an open house for all of you that are here, and some celebrations of further work that's underway. Let me make sure to take this opportunity to thank all of our teams, all of the teams working across women's and children's health, across the MCH and MUMC sites, but also across the entirety of Hamilton Health Sciences. All the outstanding work that's been accomplished really over the last trying 3, 4, and 5 years. Over the last 18 months, we've really focused at McMaster Children's Hospital on putting in place brand new programs and upsizing our existing programs, what we've called Growing MCH. Those are all about concrete actions to benefit the children, youth, and the families we serve by increasing our capability and capacity in light of a growing population and increased intensity and acuity of the services they require. Of course, we've done that at the same time that there have been ongoing challenges specific to us, but again, general to the entire healthcare system and society as a whole. So how have we been able to do that? Well, there's one fundamental reason, and that's because of the people, because of all of you, our clinical staff, our physicians, our support staff, our leaders, our volunteers, and frankly, our patients and families, all of us working together and sharing the same goal, which is about the very best care for the children, youth, families, and the entire population and communities that we serve. So we've made some great achievements, and you're going to hear some of those today, but there is more work on the horizon. I'm excited about that work, and I'm really excited that we're now going to be able to hear some more in an update from our CEO. So I'm pleased to welcome Tracy MacArthur.
Thanks so much, Bruce. So wonderful to see you all here, and greetings to everyone who's joining virtually. Thank you for taking the time to join us this morning. And this is the second time we've started this new revised format. So I know we're always happy to hear from you, your feedback on what is the best way to connect with the organization. It's been a busy summer. It's been a busy 5 years, 10 years, 20 years, 30 years of my career. Just to echo Bruce's comments, working in healthcare is certainly not easy, but I know we all do it because we have a passion for serving and we have a passion for seeing our patients do well. And I commend you all for that. And thank you all for your tremendous dedication, to the patients that we serve. On a personal note, for me, I'm starting to settle in. I feel like I'm scratching the surface, having met thousands of people, within our own organization and within the community. Moved with my own family here to Hamilton in August, and so we're starting to connect into our broader community. My commute is much shorter. A 15-minute commute is fantastic. So compared to 2+ hours, so that's been wonderful. And I'm really proud to have my office here at this location as well at the Children's Hospital in MUMC. So wonderful, and hope to see many of you in the halls. I've enjoyed getting to know some of you just in passing or getting coffee. And thank you all again for being so friendly and so welcoming to a newcomer coming into your world. I just wanted to make a couple of comments today, and my favorite part is hearing about the work of our teams. So I want to save a lot of time for that, but I wanted to touch on some of our executive reorganization that I know you're all aware of. A bit of our stressors that we're managing currently in our environment, and then just a hint of where we're going in our future planning. Since our last town hall update, I think you're all aware, we have made some adjustments to our executive leadership structure. This has been to establish a foundation for planning for the future. It's to establish a new senior management team. It's allowed me to be very close to our different sites, to engage with folks like Bruce in a direct way, and to ensure that we have a very inclusive and representative senior management table that we've now newly convened. We're a very large actually organization. And, it's my hope that we really engage in a very decentralized way our leaders so that you're empowered to move our organization forward, and that we not try and centralize this very big ship in a way that it cripples our ability to be nimble and to make, to make decisions. So as you see some of the changes that I intend to make in the organization, keep that in mind. It's really with the intention that we create a nimble organization, and so that many of you, even down to the front line, and certainly our frontline management, are able to make some of the decisions need to be made without us getting in the way. I look forward to working with our executive team, our newly convened executive team, and really our focus right now is quality, efficiency, and certainly how we can support our frontline teams who have gone through such a difficult and challenging time over the last number of years. Our financial performance, our financial situation is, of course, absolutely critical for our organization. We do run an almost $2 billion corporation, and we have to be good stewards of the public funds and be able to support the almost 20,000 people that work here and the many hundreds of thousands of people that we serve in this community in a responsible and sustainable manner. So we do need to balance our budget, and we do need to provide care for all of those that rely on us. And that requires probably some hard decisions in the short term. And I think I just want to be really transparent about that. We have very significant, immediate financial challenges that must be addressed in the coming months, so not years, in the coming months, in order to stabilize the organization so that we're able to move forward in a reasonable way. And our newly constituted senior executive team is very engaged now in working on a plan that will allow us to have that stability and that security to move forward. As I mentioned, favor very much a decentralized process. I would like to hear from the leaders within the organization. There are wonderful ideas. 20,000, 18,000 people with thoughts is far better than one or two individual with thoughts and ideas on how we can improve things. So please reach out to your leadership, reach out to your teams when you're invited, and certainly even when you're not invited, to provide feedback on processes and how we can do things better and how we can tackle some of the challenges that we're currently facing. We are, as a regional center, we run a number of large provincial programs, one of the largest academic hospital systems in Ontario. We need to prioritize the care that only we can provide and preserve the quality of care that only we can provide. That is what our partners in the system rely on us for. And it's important that we make some decisions around prioritizing where we direct our service so that the kind of care that you receive here at Hamilton Health Sciences is available to you because you can't get it anywhere else. Certainly that includes our tertiary, quaternary care, many of the big provincial programs that we run. We also need to make sure that we have the right resources assigned to those critical programs so that we can deliver the highest quality of care. We cannot stretch ourselves and impact quality. To put it bluntly, we have to do what we're funded to do. We cannot overextend ourselves beyond what we're funded to do. And we need to provide an exceptionally high level of care for the services that we provide to the community in order to earn and maintain the trust of our community and our partners. Also, of course, in terms of funding, our advocacy and negotiation with the government continue. But of course, solutions aren't always just about adding new money, but about prioritization, about innovation, about focus, and about creativity. So I look forward to engaging with all of you, and certainly through our senior leadership team, on a number of our solutions to the kind of short and midterm challenges that we're facing. That said, while we work on these short and midterm challenges to stabilize our financial position, which is not unlike the vast majority of hospitals in the province right now, we still need to look to the future. We still need to engage our entire workforce on longer term strategic planning so that we have a vision and plan for the organization that is going to take us out to the next 10, 20 years and beyond. Yes, we have to solve immediate problems, but we can't lose sight of the long-term big picture, because much of the innovative thinking and strategic planning, that's going to provide the solutions for the problems we're facing today. If we just fight the fires, we're not actually going to make some of the long-term transformational investments we need to make that are going to provide a sustainable organization, a transformed health system that we all need to support our community in the future. So it's time to think collectively about where we want to go as an organization. Our current strategic plan is almost 10 years old. I'm hoping our strategic planning process, which is starting now over the next couple of months, is going to be a very bold and engaged process. It will have lots of opportunity for input from those within HHS, but also our broader community, and of course, the patients that we serve. So you'll hear more about that as it continues to unfold in the next couple of months. But I just wanted to underscore that point. We have to do both things. We have to address some of the immediate pressures that I know everyone in this room is facing, while also looking to the future and investing in where do we need to go longer term, where do we need to have innovation, where do we need to have creativity, so that we end up in a situation where we're not just fighting fires, but we're actually planning and building the infrastructure that we need for a sustainable organization. So thank you all. I would like to just invite you again to please share your thoughts. Many of you do reach out to me or my team on email, and I do see all of those messages. And sometimes I'm able to respond directly, and sometimes I ask a team member to respond. But this is the time to really be creative and bold, and to share your thinking, with your teams. And I think we have a very bright future ahead. I wouldn't be here if I wasn't incredibly optimistic about where we can go. And as I said, back to my opening comments, I've met thousands of people within this organization and within the community, and the amount of talent, the commitment, the passion, the perseverance through very, very difficult issues is awe-inspiring. We have the skill here. We have the dedication here. We can get through this kind of short-term difficulty and actually be a leader in transforming what our healthcare system looks like. I'm absolutely sure of that. So I'd like to thank you all. And I think I'll stop there and invite any questions, invite Bruce up as well. So any questions from the audience or online, and we're happy to comment.
Yeah. And we do have a mic, so Dr. Johnson. And we will ask you to use the mic so that folks in TV land can hear you as well.
TV land. Hi, Tracy. My name is Natasha Johnson. I'm a pediatrician and an adolescent medicine specialist here. And I'm just giving you a bit of context for my question. I was also the division lead for adolescent medicine and the co-medical director for the eating disorder program for about 8 years. I wanted to say one thing. I'm so happy you're here at MCH, and situated here. Yay! But also, in addition to that, my question is, how do you balance between what you said, providing the care that we're funded to do, versus innovation? So, for example, the eating disorder program, which is one of the largest, if not the largest, outpatient eating disorder program in the country now, started without funding for it. So we kind of built the case, and then we're able to advocate for funds for the ministry. Similar, our gender program. So I'm just sort of wondering, how do we balance between innovation and the need to create the case?
Yeah, that's an excellent point. And almost every new program I've ever built, you have to demonstrate that it works first before you'll actually get long-term funding. So no intention to take away from that at all. I think what we need to focus on is how do we intentionally build in the opportunities for innovation within priority programs that we want to move forward. Because if we try to move forward on 400 fronts, that's when our resources get diluted and diffused, and we don't end up moving the dial on anything, right? It ends up, it's like, what's the it's like ripples in a stream, you know, you lose it. Whereas if you're intentional about, here are areas where there's great need and this is a priority for us, given our role in the system, let's intentionally focus on that innovation and that build and that investment in order to serve the community. Thanks.
We again do invite questions from online as well. Please use the Q&A function and we'll read them out to Tracy. Any more questions in the audience here?
Thank you, Tracy. Thank you, Bruce. Angelo Microgenakis. I'm the chair and chief of the Department of Pediatrics at McMaster Children's. Just following up on that theme of innovation and your restructuring within the organization. There's a feeling in the past that some of the innovation, if it was unique to specific programs or specific areas, that was an issue and that we needed to innovate across the entire juggernaut of the corporation. And from a structural perspective, I can understand that in terms of making things roll out smoothly. At the same time, it's in conflict with being able to take advantage of certain things in certain areas or prioritize certain areas. How is this going to be different going forward for programs, or specifically say for MUMC as a women's and children's center within the broader organization?
No, that's a great question, Angelo. I'm glad to speak to that. You know, we're a gigantic corporation. We need to have a common look and feel and common standards and certain corporate initiatives, et cetera, that are common across the entire entity. That said, we have a great diversity, you know, within just our major hospital sites alone. And that actually was, you know, one of the drivers for me in the reorganization. And I've had a lot of conversation with Bruce around this. You know, at the corporate level, we want to set standards, expectations, performance standards, values, what's the look and feel, et cetera, but then empower the sites to operationalize that in the unique ways that it makes sense for the sites. Because if you try and channel everything into one centralized process, it ends up being crippling just because of the size, but it also doesn't work for when you have a cancer center and a pediatric hospital and you know, a trauma program in a major general hospital. Those organizations are very different. So I think we'll flesh that out in more detail in our strategic planning, but what is the right balance that we strike with, okay, well, this is what HHS looks and feels like, and this is how, say, we support our workforce and our community and our branding and our values and our performance targets and our onboarding and our research and how we manage students. So what are the things that do need to be common, but then what are the operational practices that actually should be unique to the different types of organizations we serve? So it will be a shift. Yeah.
Okay, so the question from our Zoom, participant is, in your early engagements with staff and community, are there any areas of opportunity for improvement that have been highlighted and you hope to see evolve in our new strategy?
That's a loaded question. So I was a chief operating officer, and I've run clinical programs. So that said, when I walk everywhere, I can certainly see things I would do different. I'm not gonna do that. I certainly see things I think, oh, that program should grow, or this program should come, you know. So I could get pulled right into it. I will answer the question by saying what I see that's extremely encouraging is almost everywhere I've gone, if not everywhere I've gone, there is a desire expressed to me of, we want to do X. We want to move this forward. We have an idea. We have a quality improvement idea. There's no resistance to that. In fact, if anything, there's this untapped energy that I felt everywhere of how the teams want to improve and move forward. So I think my job, less so than identifying things, you know, I would do in some of the jobs that I've held in the past, it would be more, how do I break down some of the structural barriers for the teams so that they're empowered to make some of those changes. Some of you may know my background is in quality improvement and patient safety. That's what I did my graduate work in. And the thing that is sort of drilled into you is all of the best ideas come from the frontline staff. And so if I may see something, that's one thing, but I don't understand the nuance of it the way that our frontline staff do. So that is important to really engage everyone who's carrying out the work every day. Thanks, Kaylin, for raising that.
Yeah, please go. And maybe we'll, because I know folks also want to hear from our presenters, so maybe we'll make this the last question, and we'll just see if there's any other questions from Zoom. So Yelena.
Okay. Tracy, you talked generally about your vision for HHS, but I know when you traveled with me and my teams, you shared that you've been a user of Children's Hospital Services. So with that lens, could you tell us what your vision is of a high achieving children's hospital?
Yeah, thank you. Thank you for that. So, as many of us who work in healthcare, you have some personal experience that probably got you into healthcare in the first place. And certainly some of my experience as a younger person informed that for me. My big takeaway as an individual and also as a mom, because I'm a mom as well, is engaging the family and creating a family-friendly space. And that is something I do see here. I certainly see it when I come into my office every day, how much the family is connected, but really are arming that family with the information they need to be in. I don't want to keep going back to that theme of empowerment, but a family can do a lot to support the health and well-being of a child, and sometimes we don't maximize that. And so how can we feel comfortable to empower them? How can they feel comfortable to be empowered? I think that is a wonderful hallmark of a high-performing organization when all of the team members are bringing something different, and I include in that team the patient themselves and their family, and even the kids. So I have to tell you, I have a younger son who's 12, who he's probably the most responsible person in our household, right? So, Dad, did you close the garage door? Hey, I have this assignment due tomorrow. So also like letting kids take control of their own health and actually focus on empowering them too. I think that takes us beyond just treating an illness to how do you create wellness in a community, and how do you create that really extended team within a community. Thanks. Okay, so I think we'll move on. Thank you so much. Thanks for those questions. And if anything else comes up, I'm happy to hear from all of you. I'll stick around for the open house as well. Thank you. Oops.
Tracy, on behalf of everyone here and everyone across HHS, huge thanks for your remarks and for your leadership and for your passion. I know that here at the MCH Mumsy site, we were so excited to have the town hall coming here, and so I'd encourage all of you out there to get ready for the next visit of Tracy and the town hall coming, I believe, in October. Now, one of the pieces that I know all of us really love is the opportunity to hear from colleagues about their successes, and really proud to share and excited to share two success stories you're going to hear about today. They demonstrate how advocacy leading to innovation, then combined with our CQI tools, and particularly again that ingenuity. Ingeniousness. How about that? I don't know why I'm struggling with that word. And creativity of our teams, of the people that work here, and the people who work with families and with patients can come together, staff, administration, and physicians, and make a real difference in the lives of children, youth, and families. The first program you're going to hear about is the Entry to School program, and it really does exemplify multidisciplinary collaboration. Now, this is a really neat connection to Yelena's question and to Tracy's comments, because this is about providing extra support for children with autism or with a diagnosis of autism, and particularly to their parents and their caregivers, so that they feel more confident and prepared as their kids get ready to enter the classroom. It's a collaborative approach. It enables the program to be individualized to each child and their family and the community around them. So we're going to hear from Allison Shields and Amy Phillips, the clinical managers for our autism program, as they talk to us about that. After Amy and Allison, we're going to hear about the fantastic work leading to the creation of our same-day overnight unit here at the Women's and Children's Hospital. That innovation allows patients, women, children, pediatric patients, and adults who have less complex surgeries during the day to stay overnight without being formally admitted to the hospital. The patients are then able to go home by 7 a.m. the next morning, and the hospital benefits by reserving inpatient beds for kids who need to be admitted. So at that time, we'll hear from Carolyn Dunnett, who's the Director of Perioperative Services, and Carolyn Mirza, who's the Clinical Manager of Perioperative Services, and they'll talk to you about the steps that led to that success. So again, let me first begin by welcoming Amy and Allison to talk to us about the Entry to School program.
Thank you so much, Bruce, for that introduction. It is truly a privilege for Allison and I to be here today on behalf of McMaster Children's Hospital Autism Program to share and celebrate the incredible work that's happening within our Entry to School program. It is one of the many services offered through the autism program. And for anyone who's interested in learning more about what's available, we've included a QR code on our next slide that will take you directly to our service guide. It includes services that are available at no cost to families, as well as marketed services. Our Entry to School program is funded by the Ministry of Children, Community, and Social Services as part of the Ontario Autism Program. 4 years ago, McMaster Children's Hospital took the lead in partnering with 5 other organizations to develop a regional proposal. In addition, we have collaborated closely with our community partners, and we are now already in our 3rd year of service delivery. The Entry to School program is designed for autistic children between 3 and 6 years old who are entering kindergarten or grade 1 for the first time. Invitation letters are sent to families of eligible children who are registered with the Ontario Autism Program. The program consists of a 6-month group-based skill-building program focused on helping children develop school readiness skills in 6 key areas, including communication, play, social interaction, functional routines, behavioral self-management, pre-academics, learning, and attention, followed by 6 months of transition supports for children as they enter school. Our incredibly skilled interdisciplinary team includes clinicians across the disciplines of early childhood education, applied behavior analysis, speech-language pathology, and occupational therapy. Across the region this year, a total of 558 children and their families will participate in the Entry to School program. In order to be responsive to the extensive interest in the Entry to School program, we are offering a new fall cohort with children beginning school for the first time in the new year. We have exceeded our ministry's service target, and our Hamilton team alone has more than doubled the amount of children we are serving compared to the first year of service delivery. Allison's going to share a little bit more about what services look like in Hamilton.
Thanks, Amy. 41 passionate and skilled staff work within the Hamilton Entry to School program and have supported 112 students who participated in our recent March to August cohort. 70 of those 112 students participated within our classroom model at the Ron Joyce Children's Health Center. These students attend Monday to Thursday for 2.5 hours each day in either a morning or an afternoon program. We have 4 classrooms at the Ron Joyce dedicated and designed to replicate a kindergarten classroom. Each classroom is staffed with an interdisciplinary team who work together to plan and implement daily programming tailored to the students' needs. The other 42 of our 112 total students this spring and summer were supported within our integrated community-based model. Within the community model, children receive interdisciplinary ETS services within the licensed childcare center that the child attends. The team collaborated with the childcare center educators and community supports to integrate child-specific ETS goals and strategies. In the recent March to August cohort, 35 childcare centers within Hamilton were supported. A select few students receive services in the community-based programs, such as early on centers and local libraries, which involve collaboration and coaching with their primary caregiver. These collaborations with our community partners are amazing and allow children and families to flourish in spaces that they are comfortable in. ETS transition supports are provided following their school start date, where the ETS program staff provide consultation services upon request from school staff. To assist with this transition and information sharing, each student is provided with a summary report and other resources that encompass the children's strengths and capabilities. The parent and caregiver is encouraged to share these documents with their school team. We ensure that we engage in ongoing program evaluation. Our data analysis from our 2023 cohort showed statistically significant gains for the children who participated in both the Ron Joyce classroom-based model and those who participated in the community-based model. Additionally, analysis of parent and caregiver feedback data resulted in the vast majority of families indicating the most favorable responses to questions regarding their experience with our ETS staff. Amy and I would like to take this opportunity to thank Marlene Pace, our program coordinator, Kathleen Decker and Elizabeth McAllister, the clinical leaders and superstars for the Entry to School program, as well as Holly Augerman and Bruce Squires for their advocacy and their support. But we must end by sending immense gratitude to each member of the Entry to School team. We thank them for their giving their best to each other, the children, their families, and our community. Thank you.
Great job, Amy and Allison, and congratulations. Folks, we are going to have an opportunity for questions, but we're going to save them till after our second presentation, then we'll group them together. So folks in Zoom land, if you do have a question, go ahead and write it into the Q&A and we'll get to it when we convene. So now it's really my pleasure to welcome up Caroline Dunnett and Carolyn Mersa to talk to us about the same day overnight unit. Caroline and Carolyn.
Thank you so much. Thank you for inviting us to speak here today about our same day overnight unit. I see some familiar faces who I've been able to work with over the past year and a half. We've almost been open. So as Bruce mentioned, the purpose of the same day overnight unit is to provide care for surgical patients requiring less than 24 hours of postoperative care. Our goal is to reduce the number of surgical cancellations by increasing the availability of inpatient beds for patients who truly require admissions. And we also support off-hour surgeries as well. For example, orthopedic surgeries where they may have had to be admitted, but a bed wasn't available. So now we can support them in our SDO unit. The SDO model at Mumsy provides up to 6 overnight beds for adult and pediatric patients, as Bruce mentioned as well. So this unit is located within the footprint of our PACU and same-day surgery. It's staffed by nurses from both same-day surgery and PACU. So it's really been a great way to encourage teamwork between the units. We're really seeing that they're working well together. We've also been able to really engage with stakeholders throughout the hospital to help support the unit. And it's been a really good opportunity to understand everybody's challenges and collaborate with them. So most of the patients have to be discharged by 7 o'clock. We do make some exceptions, you know, if we have to support care further. And as we said, it does support adult and pediatric patients. We're always exploring different types of patients that we can keep in our STO unit. So some of the benefits that they support patients who may have trouble voiding, trouble with nausea and vomiting, pain control, bleeding, hematomas, maybe late cases who can't go home. So we're able to support them in our units. And if they do need admission, then we liaise with 3Y or Women's Health if they do require admission. Some of the things that we kind of had to do to get this unit up and running was interact with a lot of the stakeholders to understand what support we needed and what support that they could provide for us. We also had to work with the unions to look at schedules for our staff. So that took a lot of time and kind of it was a learning opportunity for me because I'd never actually had to do that before. So it was great. We also, sorry, I lost my spot here. This is actually the first time I've talked in front of people. It's always been on Zoom. So sorry. Honestly. We also identified resources that we needed with nutrition services, child life, even things like iPads, overbed tables, things like that. We engaged Epic for order sets for the units, developed an emergency care plan for urgent situations, and developed pre-op education for patients, and also looked at what education is required for staff. Staff in the units were a little hesitant at first. They often would care for patients up to a certain point, but they never actually went through the whole process of discharging home necessarily. So not for all things, but there was needs identified that we were able to support with our educators. Some things that we learned, early staff engagement is key. If I could go back, I think one of the first questions I would ask is, when can we start sharing with staff? Because they had great ideas. They flagged a lot of things that we may not have thought of, recognizing that there was a lot of things that had to happen before we could do that. But I think that's, in hindsight, a question I would ask right up front when planning was happening. And then ongoing evaluation and of our utilization and our patient population is required as well. Obviously, we're definitely looking at ways that we can support different populations of patients in SDO. We've recently started to care for CPAP compliant women's health patients. So that took some time, and Phil from PICU was great in supporting with their RTs. So really appreciate that. So yeah, just really the staff has been wonderful. I think it's really been a great opportunity for teamwork, not only between my units, but all of the other units that we're supporting. So thank you to 3Y, Women's Health. There's a lot of back and forth on beds, and I think we're kind of getting to a point where we're collaborating very well. So yeah, thank you.
I think maybe I'll ask Caroline and Carolyn, and maybe I'll invite Amy and Allison back up to the front, because we do have an opportunity for questions to really learn more about the ingenuity of this group and really what's been achieved. So folks, if you'd like to type your question into the Q&A, if you're joining us by Zoom, but let's open it up as well for anyone in the room with any question to our leaders. Kim, and we'll bring the mic to you.
Hi, Kim Felker, Director for Women's and Newborn Health. Just for Caroline and Carolyn, just thanks so much for your presentation. do just want to highlight and celebrate, the truly collaborative nature of the SDO work. It was a huge amount of work, and really the sort of true spirit of women's and children's health across the whole site. The benefits have been enormous, and just really wonderful to see the collaboration that has helped to make this successful, and also helping us in the women's health program to preserve precious capacity for our patients and ensure that the right patients are in the right bed. So just kudos to you and thanks so much.
Angelo.
Thank you and congratulations to both programs on the innovation and the wonderful achievement so far. Just to plant a seed for the surgical unit, don't know what the capacity is like everywhere else in the system, and I totally understood and was at the table for the needs around the ORs and managing those patients, keeping them out of hospital beds. If there is a little bit of capacity, I'd encourage you to connect with Natalie Schindler and the Emerge leadership. There's a patient population post-IR intervention and staying in the Emerge after intussusception reduction. That's 6 hours identifiable, would probably fit into your criteria, but that on busy evenings in the Emerge department clogs up the room and the flow and the throughput. And if there would be space for this to be considered, not to overwhelm any area, but build it and they will come. From the build it and they will come, just some thoughts to take away and maybe connect with those groups about other opportunities.
Yeah, and you know what, we do actually have supported some IR patients, so I think we definitely could look at that because great idea. So
yeah, I'll just add, part of the vision of the unit is to avoid that bed admission, but it's also around site flow. SDO is a well-established model at both JH and HGH, but we've here at MUMC been able to really sort of tailor it to the site and the patients and their needs. So certainly we're trying to look at the building as a whole and how do we keep patients moving through all the various departments. So absolutely happy to connect. Yeah.
And to folks in Zoom land, there was some giggling here because it obviously an additional ask, but truly this is an example of what happens when we come together across the entirety of the organization and share what we're doing. It creates new improvement opportunities that then we run with, that leads us to ultimately, again, better patient care. So just awesome. Kaylin, any questions from our audience?
No question, just maybe one comment. So a couple, I think there's agreement around Angelo's recommendation. So this, and then just acknowledgement that this is a great example of learning from what's been successful at other HHS sites and adapting it here to meet the needs of this site. Oh, and there's more things, they're coming in. Oh, and I apologize. Yes, someone's just saying to introduce folks who are adding questions online, but that's it from our online audience. Thank you.
Any additional questions from in the room? Yes, Andrea. Maybe if you could introduce yourself.
Hi, Andrea Frolick. I'm the director of the PEACE program, the Program for Ethics and Care Ecologies. Thank you. And I really wanted to ask a question of the autism team. We run a regional ethics network, which includes reaching out and building capacity and finding partnerships with our community providers who are often encountering ethical issues in their delivery of services. And we want to really support them to develop the capacity to address their own ethics issues, but also to create like a sense of continuity between what happens with our patients here and then the values-based decisions that are made in the community. So I was looking for your advice and lessons learned about how to build those strong partnerships with community agencies, including some sort of surprising ones, library systems, et cetera. So would love to hear your wisdom about that.
Thanks so much for that question, Andrea, and want to just thank you and your team as well, because your team has helped support us through some ethical decision making that we've needed to do within our program. It all comes down to relationship building, really. at the end of the day, getting to know those in our community and the great work that they're doing, and finding ways to where it's value add on both sides, and asking lots of questions and seeing, what are the things that we can do together that is going to build stronger systems, stronger supports for the families and the communities that we serve. And happy to chat more about that too.
Great question, Andrea. Thank you very much. Okay, I'm not seeing any more questions online as I look to Kaylin, and no more in the audience. So I'm going to take this opportunity on all of your behalfs to again thank our presenters today, Tracy MacArthur, our CEO, Allison and Amy and Caroline and Carolyn, for sharing their insights and really what they've accomplished, and I think inspiring all of us. So let me close with a final thank you to all of you across the entirety of our organization for all that you do in putting your patients and their families and your colleagues first and foremost. With that, we'll wrap up for today and wish everyone a great day. Thanks very much.